All right, so we're gonna do a CT assisted prone adjustment. So the first thing I need to do is I need to motion out her CT junction to find any restrictions. So the first thing I'm gonna do is I'm gonna ask if it's okay if I open up your gown.
Okay.
I'm gonna open up the gown and I'm gonna have you move your hair away for me quick. And we're gonna start, lower cervical, and I'm gonna start motioning that out. And down. And then I'm gonna have you bring your arms to the front for me. Thank you. And then I'm gonna have you go forward for me. And then I'm gonna bring you back. And then rotate. The other direction. So she has a T3 that is left rotated. So what I'm gonna have her do is I'm gonna have her lay face down on the table. I'll shut your gown quick. If I can have you lay face down for me. She's left rotated, so I'm gonna be on the left side, her left side. Is it okay if I open up the gown again? I'm gonna find T3. And once I find T3, it's left rotated, so I'm going to use kind of a broad contact, and what's going to end up happening is my piezoform is going to end up on the transverse process of T3, and I'm going to drag tissue slack medial to lateral, kind of starting at the spinous process, straight medial to lateral. I don't want to go inferior to superior, and once I get there, what I'm going to do is I'm going to use a reinforced contact. And I've got kind of a modified fencer stance so that I can get above my contact hand. And once I'm here, I'm gonna ask the patient to look kind of to your right just a little bit. So she's gonna rotate her head to the right if it's a left rotation. It would be the opposite if it was a right rotation. She'd be looking to the left. From here, I'm gonna get above my contact, and I don't want to do a tricep extension. What I want to do is I want to do a body drop so that the force goes P to A and you get enough force to cause the correction of the restriction there at T3.